Verify healthcare provider orders.
Order to do trach care.
Introduce yourself to the patient and family if present. State name and credentials.
Hi, Mrs. Jones. My name is Laura. I'm going to be your nurse today.
Provide for privacy. Perform hand hygiene and apply clean gloves.
Curtain closed.
Identify the patient using two identifiers such as name and date of birth, and check patient allergies.
Hi, Mrs. Jones. Can you tell me your name? Barbara Jones. Yep. Do you have any allergies? Bananas, bananas. And what's your birthday? May 1st, 1963. All right.
Discuss suctioning procedure and reason for procedure.
Mrs. Jones, I'm going to do a suction of your trach. It sounds like you're a little gurgly in there, and we just want to make sure all of that stuff comes out and doesn't give you any problem breathing.
Clean the over bed table with disinfectant wipe. Remove gloves and perform hand hygiene. Gather the necessary equipment and supplies. Pulse oximeter, suction and oxygen equipment, trach care and suctioning tray, 0.9 normal saline solution, new trach securement collar, extra clean gloves, disinfectant wipes, Chuck's pad, and small disposable trash bag.
Okay.
Apply Chuck's pad to the patient's chest. Place a trash bag on or near the bed. Assist patient to appropriate position with the head of bed elevated 45 degrees and remove pillow if necessary. Position bed to comfortable working height and lower side rail. Perform hand hygiene. Apply gloves and PPE as necessary. Keep in mind a mask and face shield may be recommended. Turn the suction device on and set the vacuum regulator to 80 to 120 millimeters of mercury. If more viscous secretions are present, additional suctioning may be required. Connect one end of the connecting tubing to the suction machine. Check the negative pressure of the suction apparatus by occluding the end of the suction tubing with your thumb. If indicated, increase the supplemental oxygen therapy to 100% or as prescribed. Encourage the patient to take a few deep breaths. May use ambu bag to hyperoxygenate patient for a few breaths.
Take a couple deep breaths for me. Good job.
Remove gloves and perform hand hygiene. On the bedside table, prepare the workspace using aseptic technique by, on saline solution, check expiration date, read label 3 times, open normal saline and lip solution.
0.9 sodium chloride. Expiration date 12 of 2022. 0.9 sodium chloride. Expiration date 12 of 2022. 0.9 sodium chloride. Expiration date 12 of 2022.
Leave the lid upside down on the table. Open the new collar, open the new disposable inner cannula, and then open the trach care and suctioning tray.
stick dye, inner cannula.
Okay. Make sure oxygen source and oxygen trach collar delivery systems are available.
They're available.
Remove the sterile drape from inside the trach care tray and place it on the table to create a sterile field. Remove the inner white tray holding the gauze and other items by using your bare hand, picking it up carefully by the plastic tab on it and using your thumb and index finger. Carefully shake contents slowly onto sterile field so that the gloves and other items separate. Place little container out of the way. Pour normal saline into 2 separate areas in the tray. Don sterile gloves. Place 2 of the gauze 4x4s and 2 cotton tip applicators into the saline. With dominant hand, pick up the suction catheter, taking care to avoid touching any non-sterile surfaces. Wrap the suction catheter around the sterile dominant hand to help prevent inadvertent contamination of the catheter. With the non-dominant hand, pick up the connecting tubing and connect it to the suction catheter. The non-dominant hand is now contaminated. Connect the suction catheter to the connection tubing. Ensure that the dominant hand does not come in contact with the connecting tubing. Check the equipment for proper functioning by suctioning a small amount of sterile solution from the container, which only has saline in it. Remove the oxygen supply if used and warn the patient that you will begin suctioning now.
I am going to suction your trach. It does not take long.
With the dominant hand, gently but quickly insert the catheter into the artificial airway with the control vent of the suction catheter open. Insert the catheter into the trach tube until resistance is met, then pull back 1 to 2 centimeters. Using the non-dominant thumb, just press the control valve of the suction catheter continuously to apply suction while completely withdrawing the catheter. Consider hyperoxygenating the patient between each pass of the suction catheter. Place the tip of the catheter in 0.9 normal saline to clear secretions and re-lubricate tip. Perform 1 additional pass if the suction catheter, if secretions remain in the airway and the patient is tolerating the procedure. Allow a minimum of 20 to 30 seconds between passes for patient to recover. At the completion of the suctioning procedure, hyperoxygenate with 100% oxygen for 30 seconds. Turn off the suction machine and disconnect tubing from the catheter. Return supplemental oxygen to baseline level or remove supplemental oxygen if not needed. Assess the volume, consistency, and color of the airway secretions. Notify the practitioner of pertinent changes. Wrap the catheter around the non-dominant hand after the suctioning is complete. Pull the sterile glove off of the non-dominant hand inside out. The catheter remains in the glove. Remove O2 device if in use. Remove old drainage sponge dressing from the trach tube and place in trash bag. Note appearance of the stoma and surrounding tissue. Remove the other sterile glove. Reapply O2 if necessary. Remove other PPE. Perform hand hygiene. Replace cap on the 0.9 normal saline solution and date. Reassess patient's respirations and pulse ox.
How you feeling? You doing okay now that we've done that?
Explain trach care procedure.
So we're going to go ahead and change your inner cannula and clean around your trach insertion site.
Perform hand hygiene and apply clean gloves. Remove O2 device if in use. While touching only the outside of the tube, use non-dominant hand to withdraw the inner cannula and inspect for secretions. Dispose of contaminated cannula in trash. Using dominant hand, grab new inner cannula out of its package by touching only the outside of the tube. Place the new inner cannula and lock into position. Remove gloves and perform hand hygiene. Apply clean gloves.
You feeling okay?
If necessary, reconnect patient to the ventilator or other oxygen source. Wait 30 seconds and reassess pulse ox and respirations. Intermittently reapply oxygen as needed per patient condition.
Give you a little increase there for a minute. Okay, fantastic.
Squeeze excess saline out of the gauze 4x4s and clean the faceplate of the trach, wiping the top aspect first, then wiping the bottom part. Use the cotton tip applicators to clean under the faceplate using a rolling motion. Top first, then bottom. If needed, pat dry with dry 4x4, being careful not to pass over the trach tube. Inspect the skin integrity and stoma site. To secure the trach using trach tube holder method. While wearing gloves, secure the new trach tube holder while leaving the old trach tube holder in place until the new device is secure. Align the strap under the patient's neck. Be sure that the Velcro attachments are on either side of the trach tube. Place the narrow end of the strap under and through the eyelets of the faceplate. Pull the ends even and secure them with Velcro closures. Verify that there is enough slack for you to slip the width of 2 fingers under the neck strap. Remove the old trach collar and dispose appropriately.
Two fingers.
Apply a new drainage sponge with the V port open at the top of the sponge. Secure it carefully under the collar, making sure it is smooth and wrinkle free.
Okay, Mrs. Jones.
Remove your gloves and additional PPE. Discard them in the appropriate receptacles. Perform hand hygiene and apply clean gloves. Position patient comfortably and perform respiratory assessment. Position the bed to lowest position and raise the side rail. Place the call button easily within reach. Make sure the patient knows how to use it for assistance. Store the 0.9 saline solution in an appropriate area per institution policy. Thank the patient and assess for additional patient needs.
Everything okay? You feeling good? All right, well, here is your call light. I'm gonna put your head down a little bit. Is there anything else I can get you? Thank you so much.
Maintain sterile technique and safety throughout procedure. Maintain professional demeanor and language throughout procedure.